Good afternoon, Dr. Singh.
Hi.
Hi, good afternoon.
Good afternoon.
Thank you so much for taking the time out of your busy day and giving a call into the radio program. We really appreciate that.
Sure, it's my pleasure.
So, Dr. Singh, right now, so you know, this is Pat Crowley with the Chamber, and then we have JR, who is one of the DJs here at WWJB. So you know who's on the line and who you'll be speaking with. So, first of all, I would like to just say thank you to you and all the physicians and the staff at Access Health. You're all wonderful, community-minded, medically, obviously educated first responders taking care of our employees and our residents, and we very, very much appreciate all the work that you do.
Thank you. We appreciate you, Pat. You've been leading this from the front, keeping us all together, and thank you, JR, for having us here.
No problem.
Right. Well, the media is so important to really disseminate all that information. So it's, WWJB has done, and XJB has done an excellent job. And you know what, Doctor, you've been around long enough in Hernando County. We're a great community, and we work together, and that's why we get through this, and that's why we've kept our cases low as far as how many cases that have been in Hernando County, and of course, as far as getting the people who have been affected with COVID to get healthy and back to their lives. So, and I know that access is a big part of that. So what's just to share with us some of the steps that we should be taking as we're turning the corner, with COVID-19. I know we're going into the recovery phase, amen, and cases are appearing to decline. So what would the recommendation be to our listeners as far as what they can do to help those numbers come down?
Well, continue being safe. Make sure you keep our elderly, our parents safe in our homes. Make sure they don't get exposed still to the viruses. Keep wearing your gloves and masks if you're going outside. But also very important, build your immunity. So that means eating healthy. This is not the time to eat cookies and cakes and gaining weight. Most of my patients, I have to get upset with them. They're all putting on weight because they're staying at home. So please make sure you exercise, you go out in the sun, build your immunity. Don't make your sugars go up or your cholesterol go high. And take your vitamins, vitamin D, vitamin C, vitamin A are supposed to be helpful. A good attitude, being grateful, being patient with each other, supporting each other, and smiling, laughing, and being together. Do not lower your guard yet because we are not out of the woods. Yes, we have done very well. Hernando has had only 100 cases till now, but our risk is nursing homes, our elderly population. So just let's be safe and keep following the recommendations as they're given.
So I just think, and all the things I've read and of course listened to, our new normal is we're going to be living with COVID for quite some time until, there is a vaccine that's been put together and tested and created. So I know that you work with a lot of your patients are elderly, or we'll say 65 and older. And I'm 64, so I laugh because I could be your patient next year. But Access Health, of course, works with, I would say our most vulnerable, which of course are the older population of Hernando and Citrus and Pasco. So, what do you see as the new normal for your patients and for our community?
We are beginning to use more telemedicine, so patients who are stable, we are trying to see them, connect with them when they're at home. Hospital patients, we are trying to only have one physician round and go policy, so physicians are not staying in the hospital. They go and see the patient, usually one provider per patient, and then they go home when they are done. So we try to keep our physicians and staff safe while trying to keep our patients safe. The third most important thing is when patients come to the office, we are screening them right at the door. We bring them into the room, no waiting room, not sitting in the waiting room, making sure everything is clean, made septic before they come in, keeping the visit short and specific, and do not have to wait in the waiting room to get a follow-up appointment. They go directly home. We clean it again. Physicians, providers, staff is wearing gloves and masks, and all door handles are cleaned, making sure vitals are taken in the rooms, not outside. So these are very simple precautions that we're trying to do, and this will continue, as you said, until we get a virus Although we're not sure we will get it, there are some promising signs. But in the meanwhile, the most physicians, doctors, specialists are recommending that we continue to stay healthy and safe. And staying healthy, as I discussed earlier, means keeping our immunity strong. That is our first defense, God-given defense against all these bugs and viruses and bacteria. They keep us alive through this sea of bacteria, and I think we should remember that. So have faith in the body, have faith in yourself, and be confident. Just don't do anything dangerous, but keep that silent faith in yourself. And we are praying a lot, so that I think helps in this through this.
Right. I totally agree. Spiritual is just as important as physical. I think that's so important. And we can do those things. I mean, we're so blessed to be in the state of Florida where the sun shines. Even yesterday, it was kind of partly cloudy, a little misty. Great day to go out and take a walk in one of the parks or in your neighborhood. And you're right. Eat healthy, drink water, and take your supplements, take your vitamins. And if you have any type of prescriptions, make sure that you take your medicine. So I think we need to be very, very cognizant of our own health. I think they call that accountability, right, doctor?
Yes.
And then, of course, being, I use the word respectful to our friends and our family. And when you're out, be respectful to the people that you're in the room with. Make sure that you social distance and keep that as the forefront in your head, in your mind. So, I think, again, the only way we're going to get through this as a county, as a state, and as a country is really working together. So for you, the ideas for the future we should become accustomed with and learn is basically the things that we're talking about as far as, these are the new norms that each person is going to live in their life right now. Yes.
And keep our parents occupied. Don't let them go into depression. They are restricted. My parents have been in our home for the last 6 weeks. So we have to keep them occupied. We have to make them feel involved, informed, make them feel productive. Because if they start going into depression, then, suddenly their immunity goes down. Play indoor games, keep physical activity at a premium, even though, we're not allowing people coming from outside, unfortunately, the therapists and all, so that, I'm trying to be too careful. But that doesn't mean we just put them in a corner and forget about them. They have to be made physically active. We have to push them a little bit and try to keep them as part of the community and make them feel loved and as part of this whole fight back, because that will make them feel good about it.
And yes, our elderly, who even if they're in great health or who have compromised health, they are the most important. So, even in your own neighborhood, there might be an elder, woman or man living by themselves. Knock on the door and drop off some food to them or see if they need anything. But you talk about, people who are, home. A couple of my friends, they're doing jigsaw puzzles, so, husband and wife, they have been home for quite a few weeks. They're doing crossword puzzles, jigsaw puzzles, things as far as words with friends, anything they can do. But people are pulling out the boards and putting them on their dining room table or their kitchen table and doing jigsaw puzzles, which is lots of fun. Playing Monopoly board games, things like that. So great ideas to do that and to obviously involve your grandparents and your parents, because you're right. If they're home like your parents are and haven't been out for 6 weeks, they really need stimulus. They need to be, engaged and, because you can't just sit and watch TV all day long.
Yeah, we are FaceTiming almost every day, talking to each other. I call them every day so they feel connected. And they are actually avid learners. They're getting on social media and reading up and putting their thoughts out. So just remember when this generation grew up with newspapers and radio. So, but they are willing to adapt and they are fast learners.
Mm-hmm. Yes. Well, what happens is that the newspapers are minimal, so therefore you have to find your news in another area. So the computers are definitely the way to do that. How do you feel about the incubation periods? Are they beneficial in any way? Do you think that people who may have been exposed, you were in a room and somebody who's been diagnosed with COVID? Is it important for that person who was in the room exposed for them to go into a incubation period? Going into...
Yeah, so self-quarantine, self-isolation is a smart thing to do. The Department of Health is telling people if they have a cold, stay at home. If it starts getting worse, please let us know. We can screen you. If we need to evaluate you, get chest x-rays, pulse ox to see if you are beginning to get any infection. Surprisingly, one of the earliest signs is low oxygen. It may not show up on the x-rays. You may not have any major symptoms. As they say, loss of smell, loss of taste, little cough. So we have to, if you start having symptoms like that, please let your doctor know so they can do a quick screen. And please feel free, help your family or friends help you get on that monitor and see if we can do telemedicine. Always happy to connect, and it gives us just another avenue, another kind of in our arsenal, another way of connecting with each other. So let's use technology. I mean, this is probably the best use of technology. If you have exposure to anyone, we are sending our staff, not allowing them to come to the offices. Stay at home, be responsible, give it at least 7 to 10 days, and ask questions. We are happy to help, give answers. We have great infectious disease doctors who led this charge, amazing people in the hospitals, in the emergency rooms who are willing to help with the questions. So be careful. We have to connect with ourselves at some point and with each other, and I think this is a wake-up call. This is kind of a stress test for all of us, and I think we are learning from it, and let's continue with that lesson. Let's not revert back to our baseline of being disconnected from each other and being irresponsible.
Agreed, very much so. So final words of encouragement for those that are nervous about post-COVID, which of course we're coming into that period right now.
I feel confident that Americans have this ability to take on any crisis. In fact, we do better when we are pushed to the corner. So I think we will fight back and we will recover and we will learn from this and we will become stronger. That is my faith, and I think most of people I meet feel that way. So I'm hoping and praying that we come out of this very soon and become a better and stronger nation.
Very, very much so. So, Doctor, for anybody to reach out to access, the phone number is 352-688-8116, correct?
Yes, ma'am.
And then, of course, your website?
Yeah, website, they can connect. And I give my emails out to people. Feel free to email me. I'm happy to respond.
You are a very, very busy man, but I have to say one thing about you are very accessible. You make yourself accessible to your patients, because even though I know that you have a very large practice and there's lots of physicians that are under the Access Health umbrella, you are probably the most accessible physician that I know, on top of all the things that you do. I don't know, what do you sleep, like 5 hours a night, 3 hours a night?
Yeah, I take power naps. But, feel free to reach out to me. I would rather know sooner than later. Don't be nice to me. Send me the stuff to it. If I don't respond in 24 hours, that means I did not get the message. The firewall has blocked your message. Please let me know sooner than later. If you let me know soon, a stitch in time will save 9. Let me try to respond quickly, and I would rather get all the information, stay in touch. You're not annoying me, you're not bothering me. Most patients are so nice, they want to avoid bothering their doctor, but I appreciate it right now. Please connect with me, please tell me whatever is going on. I'm happy to help.
Well, again, that phone number is 688-8116, and that's Dr. Singh, and thank you so much for joining us, and God bless.
Thank you. Have a good one.
You
God
too.
bless everyone. God bless America.